what cancer is so frightening, so we often talk of wellness rather than illness. Okay, so we say breast health wellness. Breast health wellness. In fact, wellness is considered as an antidote to cancer and many other diseases. Okay, so in order to improve or maintain your breast health wellness, we should all be aware of our breast health and carry out self-examination.
Girls as young as 16, 17, 18, when their breasts develop, should learn how to self-examine their breasts.
Women to do self-breast examination.
Self-examine करती रहती थी और सभी अगर थोड़ा-थोड़ा करें.
Measures that we advocate for women are self-breast examination.
They should give 5 to 10 minutes in the self-screening.
Do a self-examination for the breast.
In Hindi we'll say स्तन की स्वतः जांच. स्तन की स्वतः जांच. So all girls and ladies aged 20 and above should start their breast health examination once a month, 1 week after the period. So if you have your period on 1st of a month, then you carry out examination on day 7th. So 1 week after the period, all ladies aged 20 and above should carry out breast health examination. There are 5 steps of breast health examination. So you, while taking bath, while undressing, stand in front of a mirror, and step 1 is like this, seated or standing in front of a mirror like this, hands by the side. Can you see my hands? So my hands are resting on my waist like this. So in this position, please, standing in front of a mirror, examine both mammary glands for any asymmetry, position of the nipple areola, direction that the nipple takes, the shape, the size, color of the skin, color of the areola, and any bulge in the armpit, because in this position you can see the armpit also. If you keep the hands like this, you hide the armpit. So it's very important to examine the armpit as part of the breast examination. Why? Because some cancers and some diseases of the breast may be so small, so tiny within the breast, but they involve the armpit glands, lymph glands, we call them. Just as when you have sore throat, tonsillitis, you get a gland in the neck. So similarly, there are glands in the armpit, about 15 to 20 glands. So they can also get involved. So examine. This is step 1. Step 2, hands above the head, arms raised above the head, and again look for 2 things: nipple going inside or skin going inside. Dimpling of the skin, right? Dimpling of the skin or nipple area going inside. Okay, nipple going inside or skin going inside. Then step 3 onwards is 2 steps of seeing.
Yes.
So seeing and sitting, we say S for S. Seeing in sitting position or standing, S for S, and feeling flat while you are lying flat. Okay, so S for S and F for F. Feeling in flat. So lie down on a hard bed or a couch. Keep a small pillow under the shoulder blade and hand raised above the head like this. You can put on your forehead or just above the head like this. Okay, so this will stretch the muscles, the pectoral muscles. The breast is resting on the pectoral muscle. So if you hold your arm, armpit like this, and then raise your hand, you will feel a muscle being pulled up. So this is because the pectoral muscle is attached to the arm bone called humerus. So in this position, we convert a rounded mound-like structure, a golakar structure, into a flat disc. This allows your fingers to find even a small nodule like a pea size. जैसे मटर के दाने के बराबर छोटी सी गांठ भी है, तो जब हम ऐसे 3 फिंगर से हम देखते हैं, उसको ऐसे महसूस करेंगे, तो छोटी सी गांठ भी हम लोग मटर के दाने के बराबर भी, जो हमारी फिंगर के और रिब्स या पसली, हिंदी में पसली कहते हैं, इंग्लिश में रिब केज, तो रिब केज और फिंगर के बीच में छोटी सी गांठ भी पकड़ी जा सकती है। इसलिए लेट के छोटी सी पिलो लगा के और हाथ को ऊपर रख के हमें अपना स्तन को जांच करना है। तो फीलिंग कहते हैं, पैल्पेशन और फीलिंग द ब्रेस्ट, उसको पहले पूरा समझ लीजिए कि पूरा स्तन एक डायल ऑफ अ क्लॉक है, जैसे घड़ी होती है डायल ऑफ अ क्लॉक, उसमें 12 o'clock कॉलर बोन पे है, 12 o'clock कॉलर बोन एंड 6 o'clock below the breast inframammary crease, and then 3 o'clock on the right breast, 3 o'clock will be near the sternum, okay, the chest bone, and 9 o'clock will be near the armpit. Okay, so you can imagine dial of a clock and then palpate every part like a, so start from 12 o'clock using 3 fingers, then 1 o'clock go towards the nipple, then 2 o'clock, 3 o'clock, 4 o'clock, 5 o'clock, then from 12 to 6 o'clock we do in this supine position, lying on the back. For 7 o'clock to 11 o'clock, roll, the lady should roll herself slightly on the opposite side. Why? Because the gravity will stretch the breast in the outer part. So let her roll on the opposite side and then feel or palpate the from 7 o'clock, 8 o'clock, 9 o'clock, 10, 11 o'clock. So inner half for the rise breast, I am saying 12 to 6 while you are lying on your back. Small pillow under the shoulder blade, hand raised above the head. And you're using the opposite hand. Okay? So for the right breast, the lady is using the left hand. 3 fingers. Okay, after left. And vice versa. So from the outer side, from 7 o'clock to 11 o'clock, roll on the opposite side. Let the breast fall by the gravity towards the inner side, midline, and then palpate. Then palpate the milk ducts. You know, about 90% of the breast cancer arise from the milk ducts. That's why it is called ductal cancer. About 10% may arise from the milk gland. Milk gland has its name, lobule. So that's why it's called lobular cancer. So majority of the cancers happen to arise from the ducts called ductal cancer. So it's very important to feel the milk ducts. And the major ducts which carry milk from mammary gland into the baby's mouth are located deep to the nipple and areola. So we hold between thumb and finger, we gently roll the nipple root and areola like this 2 times, 1, 2, then 2 times sideways. Okay, so this will allow you to feel any abnormality of the milk ducts. Normal milk ducts are soft and supple, and while you're rolling them, they do not cause any pain, any discomfort, and while you're rolling them, if it yields any fluid like blood or water, then that is worrisome. You must get yourself checked. So blood or water, तो हिंदी में बोलेंगे अगर रक्त आ रहा हो, खून आ रहा हो या पानी आ रहा हो, पानी ट्रांसपेरेंट, ऐसे ट्रांसपेरेंट पानी, कोई मटमैले रंग का, मिट्टी के कलर का, ग्रीन, ब्लू और कोई कलर है, येलो, वो कैंसर का लक्षण नहीं है. लेकिन ट्रांसपेरेंट पानी जैसा या रक्त आए लाल, वो कैंसर का लक्षण होता है. उसको तुरंत चेकअप कराना, उसको कभी इग्नोर नहीं करना है. We say serous, this is called serous discharge. We say serous is serious. Serous is serious, never ignore. If it is from the single duct, if it is serous like this, transparent, if it has blood, sanguineous, we say sanguineous माने blood होता है Latin में, sanguine. And if it is arising spontaneously, स्वतः अपने से आ जाएगा. अगर कुछ लोग कहती हैं कि थोड़ा सा प्रेस करते हैं, नहाते समय दबाते हैं तो थोड़ा 1-2 बूंद आ जाता है, वो बीमारी नहीं. अगर स्वतः आता है अपने से, spontaneous discharge, serous discharge, blood or sanguineous discharge, and from the single duct, you must get yourself checked. So this is about the breast examination. Then we go to the armpit, because some cancers can spread to the lymph glands located in the armpit. The technical word is axillary lymph nodes. So we palpate the lymph nodes like this, put again 3 fingers and feel the whole of armpit for any glands or lymph nodes. So this completes the breast examination and the axillary examination. Repeat this test for the other breast using the other hand. So for the right breast, we shall use the 3 fingers of the left hand. For the left breast, we shall use 3 fingers of the right hand. Okay? So again, just to recap. Step 1, seeing and sitting. So seated, step 1, hands by the side. Step 2, hands raised above the head. Then 3 steps: lying on a flat. So feeling in flat. Lie on a hard bed or a couch, put a pillow under the shoulder blade, hand raised over the head, using 3 fingers like a dial, and then palpate the milk ducts, then palpate the armpit. And this you should do once a month, every month, starting age 20. All girls should examine their mammary glands, their breasts, and perform it about a week after the periods. If you have stopped seeing your periods, like menopause has occurred, then you can choose 1st of every month, or your birthday, or your anniversary day, or any Shubh Muhurt from Pandit ji.
All right. Thank you, sir. This was such a brilliant thing.